How's my hair?
It's beautiful.
Actually, that reminds me of a little story. I had a patient who, this is several years ago, this was when we first started using telehealth. And
So that was in the late 90s, I think, wasn't it?
Yes,
Mm-hmm.
yes. And I like the idea that we could provide service to patients who had to travel a distance. And when we think about how burdensome travel is for older people or people who are unwell or people who have mobility issues, it's nice to offer them the option of being able to have follow-up closer to their own home. And so I was getting used to learning how to operate the equipment, and there was in the bottom of the telehealth screen there's a little window that shows you what you look like, and I always had some wings sticking out of my hair, and I used to find it very distracting. So one little tip I would give you is to make sure that you take the self view off the view. In terms of benefits to patients, certainly when we think of Winnipeg and how spread out our services are and how localized the expert resources are, it's really wonderful to have telehealth available closer to home for patients, because we have to keep in mind the burden that it is to families as well. With our older patients, typically a family member has to take a day off work, arrange for childcare. If you have people who are self-employed, they're losing income for that day. Sometimes people have to stay overnight, so there's a lot of costs over and above that to our patients. It certainly takes a little bit more time and effort to set up the sessions, but it can really be a lot better for patients and their families as well, to not have them as burdened by the travel in to see us. I do a lot of prosthesis changes for patients who've had a total laryngectomy, and they have a little prosthesis in their stoma. They have a permanent opening in their neck called a stoma, and they have a little voice prosthesis that is inserted between the trachea and the esophagus. And sometimes we have to assess the prosthesis, assess the fit, assess leakage. Sometimes it'll leak through or around. Anyway, there's different problems you can get with the voice prostheses. And you can actually assess stomas and prostheses. You can get very, very good close-up pictures by getting the telehealth support at the remote end to use the handheld camera and send you either like briefly videotape the stoma or take a still picture and send it to you. And so this is just an example, and Allison will probably pass this around. This will give you an example of how tiny the devices are that we're working with, and the measurements that we can read quite well by telehealth. So this is a little measuring device that we put through the fistula where the voice prosthesis is, and we can actually measure the length of the fistula to let the patient know that maybe they need a 12 millimeter prosthesis or a 6 millimeter. This would save them the trip coming into Winnipeg where we have to measure it. Then we have to order the prosthesis, then they come back for another trip. I've also used this with patients where when we're teaching them how to change their own prosthesis, and another story related to that, I worked with a patient who was a dairy farmer, so he had lots of responsibilities at home. He had to look after the cows twice a day, and he would look after the cows in the morning, then go literally 5 miles down the road to the telehealth session, and he and his wife would set up all the supplies, and I would coach him on how to change the prosthesis himself, with me guiding him step by step. And of course there's a lot of things you need to do ahead of time to just ensure safety. You need to have the right equipment there. You need to confirm that the patient's skills are adequate, usually by the clinical visit that you have in person. And just be aware of what safety precautions you need to be prepared for. But we were able to, over several sessions, teach him how to remove the prosthesis, reinsert it, check for the proper fit, talk with it, learn how to use a hands-free speaking valve, and yet it didn't disrupt his work running his dairy farm.
Wow.
So that was very significant to me. It was really, it just shows a good, valuable use of telehealth.
Mm-hmm.
Another story I can think of is an older man who had a leaky prosthesis. The prostheses will fail periodically and need to be changed. And he lived quite a distance away. And the prosthesis needed to be changed because if it leaks, it can cause a pneumonia, especially for our older patients who might have lung disease like COPD or something. So the options were for him to come to Winnipeg and have the prosthesis changed, to stay there and tolerate the leaky prosthesis for several days, which it's not only frustrating to be coughing every time you swallow liquids, but also the risk of pneumonia. We also could have, the third option was to have somebody at the hospital or a family member remove the prosthesis and put a catheter in to stop the leakage. The downside to that, the upside is it would stop the leakage, but the downside is he wouldn't be able to talk. And so it turned out, though, that weekend he had a family wedding. And so we thought about what we could do, and we always get our patients to have a spare prosthesis on hand. So we set things up so that his daughter could change the prosthesis with nursing support at the telehealth session. It was a nurse who was very comfortable with managing tracheostomies. And so he was able to get the prosthesis changed and talk and drink and eat and swallow and attend the wedding and dance.
Wow.
So, one downside to telehealth is that you can't be physically near your patients and
To comfort them.
Yeah. And I worked with a patient recently. It was a young woman who had just completed cancer treatment. She was very, very fatigued. She actually had a good outcome from the cancer treatment, but she was dealing with the side effects of treatment. And she was very emotionally fragile. She also had a lot of things going on in the family. She appreciated the ability to have follow-up for her rehabilitation by telehealth because of her fatigue. It saved her from traveling. She also was on a farm and had farm responsibilities. And she appreciated the face-to-face more than telephone follow-up. Plus, one of the things we were doing by telehealth is reviewing her swallow rehabilitation exercises. So I could demonstrate them for her, and she could show me her technique, and I could give her feedback on it. But partway through the session, she became quite tearful when I was asking her how she's doing with other aspects of her life, and there was a pretty serious family illness going on, and she became quite teary, and we had to kind of stop for a while. And it was certainly hard for her, but as a clinician it was also hard for me, because when a patient is experiencing distress like that, you just want to be able to reach out and touch their hand or hand them some Kleenex or something, and just provide a little bit of comfort, get them a glass of water, those types of things. So you miss that physical contact or that physical presence around your patients. So in situations like that, it's often better if you have the patients attend with a family member, especially if there's likely to be some distressing news or topics. But I think it's still worthwhile to ask the patient what their preferences are, because that still may be ultimately the least burdensome and most comfortable way to have follow-up, even though they're not physically there, but it's still ultimately what was best for this woman at that time.
Okay. Okay, I gotta put my hand down.